look to their medical history. Ask them, do you have any fake teeth? Do you have any extractions? Have you had any trauma to the face? Like if you get punched in your teeth, right? That could cause some scarring too. Try and figure out exactly what it is that could have happened that would enable you to use this extra piece to push healing a step further. Hello, everyone, and welcome. I'm Dr. Rob Vanbergen, Doctor of Natural Medicine, Doctor of Humanitarian Services here at Pain Free for Life and the Sana Institute. And in this video, we're going to guide you on the journey into the often overlooked connection between your teeth and your overall health and how this applies to our clients. Over the next 10 minutes or so, we want to dive into the world of dental meridians. And these are very, very fascinating. It's the energetic pathways that link your teeth to every organ and system that resides in your body. Many chronic health issues have roots that trace back to disturbances in these meridians. And yet this connection is very rarely addressed in conventional care. In fact, we continue to disturb it in conventional care. So we're going to take a look at the dental meridians, and we're going to talk about how we can treat them as certified pain resolution specialists, being that we shouldn't really be going into the mouth with these microcurrent tools. So we'll talk about the best way to deal with those, and I'll look at the different organs that are associated with the different teeth and what they can do if they are left kind of untamed. So whether someone you know is struggling with chronic pain, with unexplained fatigue, with general health issues, whether that's a client or a friend, this is a huge piece to understanding how to actually unlock the power of healing in the body. Now, dental care is incredibly important, and holistic dental care recognizes that the health of the mouth is deeply interconnected with the health of the entire body. As I said, every tooth is linked to specific organs and systems through energetic pathways known as dental meridians. And this means that infections or extractions, inflammation, these things can all have far-reaching effects beyond the jaw. So holistic dentistry aims to look at the oral cavity and to explore oral health from how that impacts the whole body. Now, we're looking specifically today at how microcurrent therapy can be used for this. So I'm going to share my screen here with you. And hopefully it will pop up in a second there. Perfect. So the tooth and organ relationship is something that I find incredibly fascinating. And you can see how this is laid out with every single organ and gland connected to a single or multiple teeth. Now, the way to look at this is twofold. First off, we can have an impact from the organs on weakening our teeth. So if we look at the bottom here of this organ chart, for example, and we see the lungs here, okay? So the lungs could be impacted by this tooth here, the second molar, or the first molar. Meaning that if we have a lung problem, say we have asthma, for example, we could have weaker second and first molars on that side, okay? And on the other hand, you can also see these organs cropping up in other places too. So lungs are up here. So there are multiple teeth that can be impacted by a lung health problem. So you can see I'm just highlighting these here. You can see down here as well, right? So it's just like most of the body. These are often very mirrored. But this could be going from the lungs to the tooth. So by treating the lungs, we could be helping the tooth. On the other hand, it can go the other way. So damage or infection to any of these teeth could impact the lungs and the large intestines. And so we're setting ourselves up by not caring for one thing as much as the others to fail in the grand scheme, and we may be ignoring some of the energetic roots. I tend to talk about teeth as the fuses of the body. Like if you think about these fuses, they can go, and when one goes, the organ systems powered by that fuse are going to be weakened. Now, note as well at the top of this chart, you've got the thyroid, you've got the pineal gland, right? So there's different glands on there as well, a thymus, that can all be impacted, including the breasts on here, left breast on this side and right breast on the other, when we're talking about cancer and things like that. So, how do we look to actually resolve these issues? Well, what we have to look towards is the fact that in many cases, an extraction does not mean that that tooth is no longer powered. The destruction of that tooth and having a fake tooth put in does not mean that it's no longer got an energy running to it. What it does mean is that that area where that tooth was is likely to have scar tissue. And if you know anything about microcurrent, it's that scar tissue is the first thing we want to treat with microcurrent therapy for a variety of reasons, but the most important being that if you don't neutralize scar tissue, it blocks energy flow. So one neutralization treatment is normally enough. And I know from a practitioner's perspective, you have to get certain qualifications to be able to go into the oral cavity. And so while someone who has like a dental hygienist background would probably be able to use that to explore that area. And I've even heard people that have gone to get tattoo certifications because they can do piercings as well, and they can go on the tongue, so they can then use that license to get in there. On the side I'm on, I don't have that on my license to explore that. So there's a few things I can do. First off, if I'm just doing tongue stimulation, I tend to get the client to do that. I instruct them to do that. But with something like dental meridians, it's so important to look at these that we need to be able to do the treatment directly. So what we typically would do is we would take the attachment, either the Y probe or just even the back of the device itself, and we're going to use this directly over the jawline. And by doing this in the right way, we can hit every tooth through the skin without having to go into the mouth itself. So we can set our device to 77 hertz. That's what we want to do. And we can paint over the area here, getting rid of active zones and spending maybe 2 to 3 minutes on each side of the jaw. When you get to the lips, make sure they close their lips tightly and go over the top and the bottom here, so that you're hitting those teeth that way, but the lips can get very sensitive. And then do the other side of the jaw as well to work out that scar tissue. Now, once you've neutralized that, you are well on your path to repairing. And if you can identify what's going on with the client, for example, the lungs, then you can actually look at treating those particular areas, even externally with the Y probe, to be able to actually get the stimulation of the meridian done after the scar tissue has been neutralized. If you're doing that, you're going to want to use blue stimulation, and you can hold it in place to treat those teeth meridians. Now, the optimum solution, and one that can be done for personal care or for those of you who have access to be able to work in the oral cavity, is to use the tongue stimulator. And with this probe here being fully flexible, you can set this up so that the tool itself is actually going to flank either side of the tooth. So if you imagine that this is a tooth here, you can actually put it on either side of the tooth on the gum itself. And that's going to be the best way to stimulate from both sides, and just holding it in place to treat both the scar tissue and the stimulation of the meridian points. Now, this is a very complex topic that you can explore in depth if you choose to. But the purpose of this training is just to highlight the fact that this connection exists. And it's a connection that, if left unchecked, you could be missing the piece of the puzzle that will solve your patient's problem. So this encourages us to continue to explore all avenues of everything we do and try and find ways to solve these problems. So I encourage you, if you're in practice already, or you're thinking you're going to become a practitioner eventually, to utilize this kind of dental tooth relationship, and to be able to do that to maximize the healing on the body. Look for where the problems that your clients are experiencing are coming from, and So if they're having stomach issues or digestive issues, right? Or they have liver problems or eyesight issues, look to their medical history. Ask them, do you have any fake teeth? Do you have any extractions? Have you had any trauma to the face? Like if you get punched in your teeth, right? That could cause some scarring too. Try and figure out exactly what it is that could have happened that would enable you to use this extra piece to push healing a step further. All right, everyone. I hope you found this useful. And of course, you can pause this video and look through this chart if you really want to sleuth it out and figure out what's going on. But I hope that you found this useful. Obviously, we do these trainings every week, so I'm sure I'll see you next week for another 10-minute training. Thank you, everyone. Take care. Have a wonderful weekend. Bye-bye.